Well, we're continuing the discussions of all things healthcare, this time at the Abbott stand as well, with Thomas Stanis, who is the Divisional Vice President for Eastern Europe, Middle East and Africa, and Turkey and Pakistan at Abbott. And we're going to be talking about all things future of healthcare. Thank you for joining us.
Thank you.
Thomas. Looks like a bright future because this is a busy exhibition.
It's
with lots of innovation.
Very busy, yes. It's a lot of exhibitions, but it's a very good time for all of us. I've been coming in and out of the kingdom for over 30 years now. 1989 was the first time I was here, and I can tell you Saudi Arabia has changed incredibly. In the last 5 years, though, the transformation has accelerated. And what we're seeing is things that are really coming to the fore, and I believe that we can use examples here in Saudi across the world.
Well, we mentioned earlier that you're looking after core labs yourself.
Correct.
And talk to us about the innovations that are being showcased here and how they could be very useful in diagnostics and really promoting and really penetrating the Saudi Arabian health market.
Okay, so diagnostics, if you look at the basis of it, about 70% of all healthcare decisions come from a diagnostic result. So what we're trying to do is we have core labs, as you mentioned. Those are the very large laboratories and hospitals, but we also have rapid and point of care testing. So if you've got an ambulance or if you're out anywhere, you can go and use one of our rapid tests. Those are being used obviously for COVID, but they're also for flu and many different things. So that answer gives the doctor the information he needs to be able to treat the patient.
We've also got Freestyle Libre that's got a little bit of a focus, considering how diabetes is so prevalent in this part of the globe.
Absolutely. So Freestyle Libre is wonderful. As I mentioned, this was a real breakthrough because if you're a diabetic and you really want to treat yourself, you need to test at least 5 times a day. With Freestyle Libre, you've got information 24/7, no blood, you use your iPhone, you swipe yourself, and you can give information. For children, it can automatically go to their parents, which is perfect. What we're doing also now is we also have a test, HB1AC, which is a long-term glucose, and we're doing that in the core labs. So together, we're measuring how a diabetic is doing, and this is something where we can have a huge impact in Saudi Arabia because it's a large burden. It's a big burden on the economy.
And Thomas, talk to us about the Global Health Exhibition. It's a huge gathering that we've seen, over 250 companies coming together, 10,000 delegates as well, what we understand. How important is this exhibition for Abbott's performance and developing those important ties across the region?
Well, as I mentioned, we've been here since 1958, and the conference, I think it's really coming into its own, right? This is a world-class conference, and I want to say it's about time that we saw this kind of thing in Saudi Arabia. We're really happy to be here. Already in the opening hours, the meetings we've had have been tremendous and very impactful. With the minister twice already, with NUPCO, with many different peoples within the organization. So it's very useful for us.
Lastly, what's the expected outcome? What would you hope to achieve following the participation here?
What you can achieve for something like this is really you're improving your connections and you're improving your understanding. What we're trying to understand is how can we help, what can we do differently, where do we need to go the extra mile to help what the healthcare system needs. So we're trying to talk as less as possible, we're listening more and more.
Thomas Stanis, thank you very much for joining us.
Thank you very much, appreciate it. Thank you.